Okay, the topic is Eustachian tubes. Now, Eustachian tubes is the pharyngotympanic tube. It descends anteromedially from the tympanic cavity to the nasopharynx. It has an angle of 30 degree with the horizontal and 45 degree with the sagittal plane, and allows passage of air between these spaces in order to equalize the air pressure on both aspects of the tympanic membrane. Now, it is, as I said, 30 degree to the horizontal, and it is 36 in length, and it is formed partly by bone and partly by the fibrous tissue. The bony part starts from the anterior tympanic wall, is oblong in transverse section with greatest horizontal dimension, lies lateral to carotid canal, and ends at the junction of squamous and petrous part of temporal bone. The cartilaginous part is formed by a triangular cartilaginous plate present mostly in the posteromedial wall of tube. The cartilaginous part descends little more deeply and is hooked like a transverse section that is complete below and laterally. The diameter is greatest at the pharyngeal orifice, least at the isthmus, and increases again towards the tympanic cavity. The lining of the Eustachian tube is from the ciliated columnar epithelium. The nerve supply is from the caroticotympanic nerves. The arterial supply is from the ascending pharyngeal branch of external carotid artery, and the middle meningeal and artery and the artery of the pterygoid canal. The venous drainage is into the pterygoid venous plexus. The relationships of the cartilaginous tube near the pharyngeal opening anterolaterally is the tensor villi palatini, otic ganglion, mandibular nerve, chorda tympani nerve, meningeal artery. And posteromedially is the levator villi palatini, the petrous part of temporal bone. So that is the anatomy of the Eustachian tube.